Alright, so this is cardiology. Alright, we're going to start with chapter 15, which is shock and resuscitation. This also kind of bleeds into trauma as well. And we'll get on with the cardiology part. Okay? So we're going to talk about shock, resuscitation and cardiac arrest, AED, CPR, recognizing and treating cardiac arrest, special considerations for the AED. All right, EMTs, tests, and staff are responding to report of chest pain, along with the crew from Engine 9. The original impression is of a man in his 50s who is sitting in a recliner, hand on his chest, in apparent distress. He is pale and extremely sweaty. They confirm acute complaint of chest pain and continue their assessment as they begin treatment. Tess is immediately concerned with the weak, rapid radial pulse and labored respirations. So what do you think the significance of the weak, rapid pulse and labored respirations are? Not pumping hard enough, okay? We got something going on with the heart. All right, what could explain the weak, rapid pulse and labor breathing? Maybe the heart's working a little too hard. Okay. So what do you think you're going to do to manage this patient? What?
I said for the labored respiration.
Uh-huh.
Maybe use concentration regulations.
That's a possibility. All right, resuscitation focuses on managing the airway, oxygenation, ventilation, and circulation. Resuscitation is most often associated with cardiac arrest. However, it is also performed in cases of respiratory failure, respiratory arrest, shock, and other conditions. All right, shock. What is shock? All right, shock is inadequate tissue perfusion, also known as hypoperfusion. Less oxygen is delivered to cells than is needed for normal metabolism. And the elimination of carbon dioxide and other waste products is impaired. Without glucose and oxygen, energy production is severely impaired. Acidic waste products accumulate and the cellular sodium-potassium pump fails, leading to cellular death. When there is a lack of available oxygen, anaerobic metabolism takes place, and the result is a drastically lower production of ATP by the creation of lactic acid as a byproduct. Energy is needed to maintain the function of the cell, the sodium-potassium pump. If the pump fails, the sodium is no longer removed from the cell in exchange for potassium. Potassium and lactic acid leaves the cell and begins to collect in the interstitial fluid and eventually enters the blood. The sodium collects inside the cell and attracts water. Okay? As a result, the cell swells and eventually ruptures and dies. The acid that has been liberated causes the failure of enzyme systems and the release of the lysosomes. The lysosomes begin to auto-digest the cell, leading to cell death and eventual organ death or failure. So how do we treat shock? We restore perfusion. We restore oxygen and glucose delivery. All right, this is going to produce larger amounts of ATP.